I got introduced to hormone therapy as a patient, and for me, it was life-changing. It was something that was so impactful that I decided I wanted to bring this to patients myself. Welcome back to another episode of Health Notes. I'm Dr. Bob. Today, I'm joined on the podcast by my partner, Dr. Doug Miller. We're here to engage with our patients. When we decided that we wanted to start a podcast, our goal was to engage with patients and share our insights that we've had over the last 10 years with our health and longevity practice. For those of you who don't know us, we're two physicians who lead a team here in North Carolina with an outstanding health and longevity practice. And with everything that's going on in the world of hormone therapy these days, we wanted to share our passion and share our insights with patients and prospective patients.
Yeah, that's well said, Bob. I'm really glad to be here too. We love talking about health and longevity and hormone therapy and the things that we can do to improve our health and prevent disease as we get older. So we've had this practice now. Bob started it back in 2015, Bob?
Right. Yeah. End of 2014, beginning of 2015.
Yeah. So over a decade of treating thousands of patients. And we've really grown our protocols and knowledge about how to age well and prevent disease. So Bob, why don't you back up a little bit and tell everybody how you started this practice? I call him the Bob father. He started the practice.
Right. You know, it's funny. This practice really was born out of my own attempts to try and be healthy. I was in my 40s and, working in the emergency department. Doug and I both have a background in emergency medicine. And over the last couple of decades, have literally had hundreds of thousands of patient interactions between us. But trying to be healthy, feeling like I ate right and exercised, but just was not doing well. I got introduced to hormone therapy as a patient. And for me, it was life-changing. It was something that was so impactful that I decided I wanted to bring this to patients myself. I spent several years learning everything I could about hormone therapy and then decided to start a practice. I needed some help, so I brought Doug in because he's an excellent clinician. And together we have built this. And it's evolved over time as our own experience and has information and knowledge has grown. We think we've done an excellent job with our patients to focus on the things that really work and go beyond just medical care, because we definitely see this as a unique, tailored to the individual program that has to involve, lifestyle changes and how do we communicate that to our patients.
Yeah, I was really fortunate to meet Bob back in the emergency room, like you mentioned. And I could tell right away, he and I were like-minded. We've always been people who care about our health, fitness. Bob was an amazing cyclist. I've always kept really fit, but I hit a wall. And I was fortunate enough to meet Bob. And I was in my late 40s when this occurred, and eventually got treated with hormone replacement therapy. And within 3 months, I was a new man. I had every symptom in the book. It was affecting my work. I had no motivation. It was affecting my home life. I couldn't enjoy my family. And it really did turn things around for me. And that's when I did the deep dive and just learned everything possible about hormone replacement therapy for men and women. And not only that, but the lifestyle modification things that we can do to improve our long-term health and improve how we feel and function. And this is the goal of our practice. This is what we hope for all our patients, is to completely reverse any metabolic disease, any hormone deficiencies, optimize biomarkers through hormone replacement therapy, supplements, nutrition, exercise. And it really is the truth to living a long, healthy life and preventing disease. And we're super evidence-based. We are clinicians first. Bob, you and I have talked about this extensively. We don't recommend a therapy unless there's science behind it. It has to be science driven because we're skeptics.
Right. I think that's definitely one of our many strengths, is that our goal is to bring the treatments to patients that really work. We get a lot of questions from a lot of patients about testing or peptides or this supplement or that supplement, and a lot of it doesn't have a lot of data behind it. So the recommendations that we make sure that they're really strongly backed by science and evidence. This is an interesting time right now, when we talk about hormone therapy, like women's hormone therapy, women's menopausal treatment is really having its moment in the sun. The FDA just recently held a panel of experts, and they're talking about removing the black box warning from estrogen. I mean, this is huge. Doug, can you kind of briefly explain what is a black box warning?
Yeah, it's a travesty what happened to women's hormone replacement therapy. What a black box warning is a FDA warning that has to be put on a product saying that you can prescribe this and take it, but there are these risks. And the risks to estrogen and progesterone in women, the perceived risk came from a flawed study done back in the late 90s and 2000s, the Women's Health Initiative, which has now been disproven. They interpreted the data falsely, and the risks are not there. But that study shut down hormone replacement therapy for over 2 decades. And this black box warning still today is on these products. So finally, it took almost 2 decades for the voices to be loud enough that they need to remove these and make this available to women and not have this fear and this negative bias against women's hormone replacement therapy, which we've been doing for over 10 years because we knew, we'd seen the data. We realized studies are flawed.
And that black box warning is a black box warning on estrogen. So it's like literally bold type, black box that says, if you take this, these are these giant risks, right? And that covered every form of estrogen, whether it was oral, transdermal, topical, and to say that all of these products were the same, that's not accurate. The science doesn't bear that out. And then, it's wild to think that hormone therapy for women used to be, that was the standard, right? Women were on medication called Prempro, which was 2 synthetic type hormones. But thousands and thousands of women benefited from it. Then the study comes out and that stops it. OBGYN starts to now say, look, you should take the smallest amount of hormones in the lowest dose possible for the shortest amount of time to control your menopausal symptoms. But, Doug, in the emergency department, we have seen the ravages of frailty, right? And to think that menopausal hormone therapy is only about hot flashes and night sweats is completely missing the fairly, right? The benefits of estrogen for women are, so numerous. When it looks at, how many hip fractures have you seen in your career, Doug? Right?
Just a few.
Yeah, that was right. A few thousand. And to think about what's the mortality of a hip fracture, people don't realize that. People think you fall, you break your hip, you go get surgery, you're fixed, you go home, you're fine. In an elderly person, a hip fracture still has a high degree of mortality to it. If that could have been prevented because someone had started hormone therapy earlier in their life, they never developed osteopenia, they still had muscle strength, maybe they didn't even fall in the first place. We look at bone health, heart health, neurodegenerative health. The potential benefits from estrogen therapy done right are numerous.
Yeah, we've known about the ravages of hormone deficiency, particularly in women, for a long time. And this study, unfortunately, just created this fear that didn't allow us to treat women. And think of how many millions and millions of women have suffered needlessly and died early because they developed osteoporosis, visceral fat, insulin resistance, chronic inflammation, dementia, all cardiovascular disease. All these things are associated with low hormones. It can be blunted and modified if you replace hormones, but it has to be done properly. It has to be done by experienced clinicians, like we have in our practice, and you have to have the right training.
Right. And I think that's something that, you and I and the rest of our team bring to the table is, 10 years of experience of treating both men and women with hormone therapy to understand the nuance of care.
Yep.
And I don't think you can replace that.
No, I remember when they announced they were stopping this study early and recommending everybody stops hormone replacement therapy. And my mom actually was on Pro,
Yeah.
which are synthetic, but it does have positive effects as well. It's just we wouldn't use it today when you can use bioidentical hormones that don't have any side effects or risks that the synthetic hormones had. But I remember that she came off of that, and she would likely have much stronger bone density, have much more muscle mass, she's healthy, fortunately, but she could be healthier. But there are women who literally die early because they didn't have this therapy available to them.
Right. But, a good hormone therapy program, a good regimen doesn't mean just slap a patch on everybody and call it done, right?
That's right. And it has to be combined with lifestyle modification. I would never recommend this in isolation. It should always be combined with the other things that really optimize how you live and how you age and disease prevention. So that's nutrition, exercise, optimizing biomarkers, reducing inflammation, controlling insulin resistance, combined. But you can't get the benefit of all nutrition, exercise, and all these things without optimal hormone levels. You need that as part of the program. So it's the whole comprehensive program that we talk to our patients about. And I think it's why we've been successful and have a lot of referrals and maintain a lot of our patients, retain them in the practice. And honestly, it's what Bob and I are doing for ourselves and our family and our friends. Bob and I have been on this journey for the last 15 years to learn about everything we can do to optimize our own health. And we're skeptics. We're not just going to take a supplement because it's hyper marketed in the GNC. Like, we want to see the data behind it. And we will only take for ourselves and our family what we believe is scientific and evidence-based.
Right.
So that's
right. I remember my own journey as a patient. And, I would be recommending, the practice that I went to, they'd be like, oh, you should try this supplement. And I'm like, oh, okay. What does it do? Oh, well, it's good for you. It cuts inflammation, right? It would be some very non-specific recommendation. So when we look, that was something I didn't like. I always felt like I was being upsold on every visit. And you and I have taken a much more scientific and rigorous approach to supplements. And, do nutritional supplements have a role in somebody's care? Yeah, absolutely. But they should be thought of more, in my opinion, as like final touches, right? These are crossing the T's and dotting the I's. These are things that will help, but their effect is smaller, right? There's no supplement that you can take that's going to replace, getting regular exercise, starting an exercise program. There's no supplement you can take that's going to, allow you to eat just anything you want and not pay at all any attention to your nutrition. But I think the other thing over the last 10 years that we've really developed is a way of helping patients make sustainable progress on these goals themselves. Rather than, you go to your primary care, once or twice a year, and they're like, well, maybe you should eat some low fat. It's like some very vague directions on how to lose weight or how to be healthier. We help people stepwise move forward and get healthier.
Yeah, what I love about our practice is the fact that we really don't have time constraints, that we can spend as much time as we need to get to know the patient and also their health problems and specific issues. It really helps me personally to tailor treatment and advice to that patient. I think patients really appreciate that. That's a bond that you don't get in conventional medicine these days. So that is definitely a difference.
If I was coming in to see you, if I was starting with you as a new patient, how would you help me understand nutrition?
Yeah, that's a big one. Nutrition is one of the most important things that you can manage to maintain your health. They say food is medicine, and it's so true. But unlike medicine, we can't really test diet and nutrition because there's no placebo control. You're just testing one diet versus another diet. But
Do you like your patients to follow a particular diet?
so there is, you can't really say there's one best diet, right? The diet that is best for a patient is one that they can stick with and that they can achieve their goals. And depends on your goals. Some people need to lose weight. And when I say lose weight, I mean lose visceral fat, lose fat mass, not muscle or lean mass. You actually want to increase your total weight, add muscle, add bone density, and lose fat mass. But there are other reasons for diet too. You may want to reduce inflammation. You may want to reduce insulin resistance. So the best diet is one that somebody can stick with on most days and achieve their goals. And it's typically weight loss or fat mass loss. So, Bob, I know you have some ideas about energy balance that you probably want to share with everybody in terms of weight loss.
Yeah, I agree. I think most patients come to us. A lot of patients come to us looking to lose some fat mass, looking to lose some weight. I think that a good nutrition plan is something that everyone needs to follow, needs to understand. And again, you're right. Depending on someone's goals, can be how fine-tuned that plan is. When you look at obesity, there was two giant schools of thought on what causes obesity. There's what's called the carbohydrate-insulin model of obesity, and then there was the energy balance model of obesity. I definitely seem to think there's more data supporting energy balance. So that's really where I go with patients. I 100% agree with you, though, that a nutrition plan that a patient can follow and can adhere to most of the time is really going to be the one that works. And there's lots of different ways to do that. I agree that there's not one specific diet. When you talk about a dietary choice, like I eat low fat, I eat paleo, I eat vegetarian, pescatarian, Mediterranean, vegetarian, whatever. That is just a tool for consistency. If this is a way you like to eat where you can meet your nutrition targets on a consistent basis, then great, then that's a good tool for you to use.
Yeah, I do think there's some specific scenarios too where that might dictate which diet you choose. For instance, type 2 diabetes. This is a specific situation where I personally prefer a low carbohydrate, low sugar diet. And that's because diabetes type 2 is a disorder of glucose metabolism and disposal. It's a disorder of glucose storage. So why not just take that off the table and remove sugar and carbohydrates from the diet? I feel like type 2 diabetics or people with insulin resistance do much better on this form of diet in terms of losing fat mass as well as improving the glucose biomarkers, lipids, all the things that weight loss helps.
Right. But you're doing that. You're recommending a low carb diet because you're trying to modulate their glucose levels, right? You're trying to prevent hyperglycemia rather than, are you saying that's a better way of weight loss for them?
I'm just saying that it's good for diabetic because they already have problems with glucose disposal. But what you're getting at is, what do I think about the insulin model of weight loss? And I do think there's some credence to that. So for sure, the way people lose weight is to be in negative energy balance, meaning you have to expend more calories than you take in. And it's largely nutrition. If you look at the exercise component of burning calories, it's much smaller. It's much less impactful, maybe 300, 400, 500 calories you can burn if you're really vigorously exercising. But you can make this giant impact on the nutrition side. You can knock out 2,000 calories sometimes and still not be on a low calorie diet, still not be on calorie restriction. So negative energy balance is important. But that's not the only factors involved. For instance, I do think that insulin and low carbohydrate, low sugar can add to the fat mass loss because insulin is a metabolic hormone that has many, many downstream effects. When you eat sugar carbohydrates, the pancreas produces insulin, and that insulin tells glucose, which is the basic sugar in the body, to be stored in the liver and the muscle as glycogen. And anything left over gets converted to fat. It gets stored in the subcutaneous fat and the visceral fat. And the visceral fat is what's really important to remove. That's why we should be trying to lose weight, because the visceral fat is that metabolic fat that's inside the abdomen, around the organs, around the liver, around the pancreas, the mesentery of the bowel. It's metabolically active. It's what causes insulin resistance and leads to type 2 diabetes. So I do think if we keep insulin levels low, it can promote healthy metabolism of fat, because insulin also shuts off metabolism of fat. It has an effect on enzymes that cleave the fat out of the adipose tissue. So I don't discredit that theory completely. It's just that there's no right answer here, that we don't know the answer. So we definitely know that negative energy balance is important, and that works. Like you could eat 2,000 calories of chocolate a day and lose weight, as long as you're expending more calories than you burn. But is that healthy for you? No. And I would argue you're going to feel hungry, and you may end up eating more because you're not satiated, and you're going to spike insulin through the roof. You're going to develop metabolic disease on that diet. So, the energy balance model is correct, but a well-balanced diet is, in most circumstances, the best one, especially if you can stick to it. If you have a variety of foods, you're going to be able to stick to that because it's pleasant.
Right. When I walk through a nutrition plan with a patient, the first thing, in my opinion, is, all right, I got to figure out where you are, right? Because we've seen patients that run the gamut, right? Some people are already really focused in on their nutrition, and maybe we just need to try and make a few tweaks with them to really nail that. Maybe that's not their low-hanging fruit. But there's plenty of people who are like, I grab something on the way to work, I grab something while I'm at work, and then I grab something, a takeout on the way home from work. And, it's all processed foods. It's all, of whatever nutritional value, and they're not really paying attention to it. So I think bringing people's awareness to their nutrition is the first step. And I always like to tell people, look, I think of this as, what's the difference between a diet and a nutrition plan, right? What's the difference between working out and training? Working out is exercise and it kind of feels good, but it doesn't really go anywhere. Training is structured and has a goal, right? And your nutrition plan should be structured and have a goal. So I work with people on, let's identify, what are you eating in a day? Can we get a handle on that? How many calories is it? Because usually once people start paying attention to it, I think they find it's a lot more than they think. Then I start focusing on, let's add high quality proteins, right? Increase your proteins, try and hit a protein target while limiting total calorie intake. And then let's find tools that allow you to hit those two markers on a consistent basis. I think if you do that, that's enough to reach anybody's health goals with a nutrition plan.
I love that framework, Bob, where you have to be in calorie deficit, but your anchor should be protein. Protein is so important for us. It's what drives muscle protein synthesis and muscle mass, and it's the most important macronutrient. I think the protein target of 1 gram per pound of weight is a great target for protein. And then you got to decide if you're limiting one of the other macros. If you want to limit carbohydrates, then you fill the rest in with fats, or vice versa. Let's say you're trying to manage lipids and you want a lower fat diet, and then you're going to have more carbohydrates in the mix. But honestly, in terms of treating elevated lipids or ApoB with a low-fat diet, I don't think it's necessary. I don't think it's healthy, because when you do that and you reduce the fats and you increase the carbs, I think that you create some metabolic dysfunction and high insulin levels in this case, and you really can manage lipids through the amazing array of cholesterol lowering agents that we have out there, statins, Zetia, the PCSK9 inhibitors. Like, there's no reason in this day and age that you need to have an extreme low fat diet to manage your lipids. So
I think I think there's a fallacy that we come across, or at least I come across a lot with patients that believe that with enough effort in nutrition and exercise that they can have a healthy lipid profile.
right.
I've seen too many people that, exercise plenty, they eat well, they eat a structured nutrition plan, and their lipid profile is subpar. It's not good. And it's a genetic component.
It's largely
So I think I think once you've maximized your return out of nutrition and exercise, that you should turn to pharmacology for that. And there's no shame in doing so. That's just using science and intelligence to lower your risk of cardiovascular disease.
Yeah, because if you think about the things that kill us at the end of the day, the complications of atherosclerotic cardiovascular disease, probably 85% of the reason that human beings die at the end of the day, from heart attack, stroke, dementia, kidney failure. All these things are related to atherosclerotic cardiovascular disease. So managing your lipids early is huge, so important, because it's residence time. The lipid is in the bloodstream. That's its residence time, how long it's there. And atherosclerosis develops over the course of decades. So you have to, proactively identify whether you have a lipid problem. And our initial evaluation does one of the deepest dives out there you can get on a lipid, checking not only the basic lipid panels, but ApoB and Lp(a). We usually recommend a coronary calcium score for people of the correct age. And there's only so much you can do through nutrition. So I absolutely agree with you, Bob. Nutrition, the way I look at it is, nutrition is really good to manage inflammation and your metabolic health. It's not the way to manage your lipids so much in current times.
Right. I agree.
And metabolic,
And again, it's nice to hear. It's nice to hear all these other people, in health and longevity space talking about Lp(a) and ApoB. We're like, yeah, we've been talking about this for years. I'm glad everybody's coming around to it. It comes back the same as hormone therapy. I'm glad people are coming around to it. We've been doing this for the last 10 years.
I had a conversation with a Wake Forest lipidologist not that long ago, and he did a double take when I told him what my Lp(a) was, and he was like, how do you know about that? Like, yeah, it's out there now. Yeah, but you gotta look for it.
All right. Doug, this has really been great. I appreciate you taking time out of your day to join me here on the podcast. I think we've covered some interesting information. I look forward to what's coming next. We want to hear from you. What do you have questions on? What do you struggle with? Where are your sticking points in your health? What are the things we can talk about and try and answer for you? We have some ideas of our own, but of course we want to hear from you because you're what it's all about.
Health Notes with Dr. Bob is produced in collaboration with Spartan Medical Associates. We see patients in person at our Charlotte offices as well as virtually throughout North Carolina. Learn more at SpartanMedicalAssociates.com. Got a question, topic idea, or feedback? Drop it in the comments or visit us at HealthNotes.net. A big thank you to DP Driver for producing the show. Finally, a quick reminder. This podcast is purely for educational and entertainment purposes. Listening to our show does not create a doctor-patient relationship. While I am a doctor and we may speak with other medical providers, we are not your doctor. The content you hear does not constitute professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider regarding your personal health matters. From all of us here, thank you for listening. Until next time, be well, stay bright.